My name is Dr. Omondi Ogada. I am a cardiologist and I work at Nakuru Heart Center. Today, 2nd of February, is World Heart Failure Day. And for this reason, I just want to bring you to first about some facts about heart failure. That 20 million people, the whole world, die of cardiovascular disease, of which heart failure is part of this. And that 80% of cardiovascular deaths are due to behavioral changes or habits. And if you can change your habits or your behavior, you can do a lot to impact on your heart failure. Part of this is smoking. Smoking contributes to about 30% of cardiovascular diseases and 90% of lung cancers. Salt intake, sodium salt. There's two different types of salt, sodium and potassium. Potassium salt is commonly known as sea salt. The other salt, which is regular salt, is sodium salt. Sodium salt is known to cause high blood pressure. And if you're already in heart failure, the sodium perpetuates your heart failure, fluid accumulation in your body. So it makes your heart failure worse. Sitting down, not exercising, is part of augmenting heart failure. So you should be in a position to do regular exercises. Regular here means that it doesn't have to be every day, but you set a few days, whether it is twice a week, 3 times a week, or once a week. But make it regular, and that it should be not less than 45 minutes, and at least 45 minutes to 2 hours, and make sure it's a sweating exercise. You can walk 100 kilometers, but if you are not sweating, it means you are not burning your energy. So the whole idea is to burn your energy so that you improve on your cholesterol levels and you also consume your sugars. If you are diabetic, make sure your diabetes is well controlled and avoid taking processed sugar or processed food. You can take natural sugars, honey, and you take it modestly. You can avoid taking what is called animal fats so that your cholesterol remains okay. And you must make sure if you are overweight, you make sure you indulge in activities and diet that will make you lose weight and attain what is called healthy weight. So healthy diet, regular exercises, and cutting your weight is very key in this thing. And then if you are hypertensive, make sure your blood pressure is well controlled. Normal blood pressure, the upper one is between 120 to 160, depending on your age, and the lower one is 80 to 100, depending on your age. The older you are, the higher are those figures. The younger you are, the nearer to 120 over 80 is. Slight figures plus or minus 10 is acceptable on either side. So if you are hypertensive, make sure you are on regular treatment and your pressure is optimally controlled. If you are diabetic, your sugar must be optimally controlled. And all this diet, exercise, all those things come into play. So kindly eat healthy, do regular exercise, stop sedentary life, and make sure your comorbid diseases like diabetes, hypertension, if you are asthmatic, whatever kidney disease, make sure those are optimally also controlled. Then that will impact well for your heart failure. So avoid normal salt. In your house, if I came there, I should only find you with potassium salt, which are readily available in any supermarket. You don't need to go to a special place to look for it. So that's my take, and I hope this information will go a long way in helping you and helping you and encouraging this on this day of heart failure. Thank you very much.